My name's Sophie Rozenzweig, and I'm currently a final year student at the University of Liverpool. This presentation is based on my second year literature review and my third year project into using pain scales to recognise pain in horses with colic. Assessing pain in equids is a difficult yet essential task. My literature review found that many equine pain scales evaluating facial expression have been assessed and validated, but no individual scale is currently considered to be the reference standard. This may be because many factors need to be considered when assessing a horse, including physiological measures, body language, and stress, and it has been suggested that the use of multifactorial or composite pain scales may prove more useful. For the assessment of pain in a hospital setting, the scale used needs to be easy, quick, and reliable. My project then evaluated 3 of these published pain scales in more detail. The first was the horse grimace scale, which is a simple descriptive scale consisting of 6 facial action units, which are given a score of 0 to 2 in accordance to the images shown. The most reliable marker associated with pain in post-operative horses was backwards facing ears. The second scale is a composite pain scale, which includes physiological parameters such as heart rate and respiratory rate. Overall, it consists of 11 parameters, each scored on a scale of 1 to 4, to provide a total out of 38. The third scale was the Equine Utrecht University scale for composite pain assessment, which is also a composite scale. It is totaled out of 42, and the original study, based on 25 colic cases and 25 healthy controls, found a cutoff value of 5 out of 42, provided maximal differentiation between the two groups. The aims of my study were to assess the 3 pain scales for inter-observer reliability, and to derive cutoff values for the horse grimace scale and the composite pain scale to help differentiate between painful and non-painful horses. 17 horses were observed following medically or surgically treated colic at the University of Liverpool Equine Hospital between August 2018 and January 2019. Trained observers completed pain scoring 1 to 2 times daily, with 12 horses assessed using all 3 scales, and 5 assessed using only the Equus Compass and CPS. Assessors were not blinded to the condition of the horses, but completed the pain scorings individually without communication. Each score was entered into a spreadsheet, and total pain scores were calculated by adding up the total of each scale. The inter-observer reliability was evaluated using one-way random absolute agreement average measures interclass correlation coefficient, which was chosen because different observers analysed each horse. An absolute value of agreement across raters was more important to assess than the consistency of agreement across raters. Cronbach's alpha was also calculated, as it is a measure of internal consistency, which is used as a measure of scale reliability. The cutoff values for the HGS and CPS were calculated by comparing these scales to the predetermined cutoff value of the Equus Compass and using Uden's index. The area under the receiver operator characteristic curve was also calculated to determine whether the pain scales can accurately distinguish between painful and non-painful horses. Correlations between observer scores for each scale and for total scores were plotted on scatter plots and analysed using Spearman's correlation coefficients, since data was not normally distributed. The scatter plots on the right-hand side of the slide show very high positive correlations between different observer scores for both the CPS and total pain scores. The CPS also showed the highest Spearman's correlation coefficient, closely followed by the Equus Compass. As shown in the table, all the interclass correlation results are above 0.75, which indicates excellent inter-observer reliability. Each scale also has high alpha scores above 0.7, which suggests they are strongly correlated to each other. A cutoff of more than 7 out of 38 was determined for the CPS, and more than 6 out of 12 for the HGS. Both the scales have an AUC ROC of 0.86, meaning that painful and non-painful horses can be accurately distinguished 86% of the time. The results of this study indicate that each pain scoring system could be used consistently and reliably by different people to assess colic cases, which is exceptionally useful in a hospital situation where cases may be assessed by multiple people each day. Overall, the CPS had the highest agreement between observers. The slightly weaker correlation and lower intra-class correlation for the HGS could be due to the scale only being based on facial expression, which people may find more difficult and qualitative to assess, which also agrees with previous studies. Overall, as there is no single indicator of pain, scales including physiological markers may be more beneficial. The calculated cutoff values could be used to help class horses as painful and non-painful to inform treatment decisions and monitor clinical progress, and further work may help validate this as a way of determining prognosis. This study was limited to medical and surgical colic cases, with relatively small sample sizes, and future research is warranted to evaluate the pain scales further in a larger sample of horses with different conditions.